India marked a grim milestone this week with more than 200,000 people lost to the coronavirus as a devastating surge tears through cities and rural areas. And for the past week, more than 2,000 people have died every single day. Crematoriums across the country are struggling to keep up with the number of bodies. And the wave has also overwhelmed the healthcare system, which is on the brink of collapse. Patients are suffocating because oxygen supplies are running out and ICU beds are in short supply. It is a fight that could have a global impact, and it matters tonight to people in America. Joining us is Dr. Dilip Raman. He is a teleintensivist or ICU specialist based in Bangalore who works for Cloud Physician Healthcare. Doctor, we appreciate your time tonight. I know it's just after 6 a.m. in the morning Friday there, so you're in the future. I wish it was brighter. We are seeing some dramatic images out of India of patients struggling with this virus, looking for hospital beds. They're looking for oxygen. Tell us what you are seeing as India deals with this public health crisis.
Yeah, thanks for having me here. Truly, some of these scenes are heart-wrenching, and we've been dealing with this for the past few weeks now. And I am in Bangalore, which is a large city in India with more than 13 million people. But we are facing these challenges partly because in India we do not have the same ICU capacity that we would need for a country our size. For instance, there are only about 5,000 qualified trained ICU doctors in India and less than about 300,000 ICU beds. And as of now, in our city, which is a fairly large one, like I mentioned before, there are no ICU beds and no ventilator beds for patients with COVID-19 pneumonia who would need respiratory support. So these are sort of the challenges that we've been dealing with even during the last surge and now this surge, which is much bigger than what it was before. But we're trying to take a solution-centric approach to this problem, and we're trying to do the best we can with the situation that is on hand. And taking care of these patients is something that we really have to put all our minds together. And what we're doing here in Bangalore, which is actually a technology hub in India, is why we're trying to use technology to see if we can act as a force multiplier for the limited healthcare resources we have. So all the ICU beds that we cover today in our city are full right now. And in our tele-ICU network, which covers about 300 beds across India, we're seeing the same problem. So what we're trying to do is use our technology to take our ICU doctors that are specialized in intensive care medicine and deliver that skill across boundaries, across geographies to help these patients who are in remote locations in our country and help them probably with expertise and skill that's required in the ICU that's in such short supply.
Can you give us an example of that type of technology and how it's working? Because you there are on the front lines, you're doing telehealth, but that can only go so far.
Correct. So our team does both bedside work and remote care, but as I alluded to, the ICU specialist expertise is what is lacking in some of these remote areas. So what we try to do there is if you have a nurse or a doctor who can follow instructions of a trained intensivist, that would go a long way in making sure that evidence-based practices and early detection of complications is incorporated in the care of these patients. So some of it we also took from the US as learnings in New York. Some of these tele-ICU based interventions went a long way in offsetting that shortage. And that shortage is even greater in India. So we have to do something like this to help the crisis at hand now.
Dr. India, the world's second most populous country, as you mentioned, was able to handle the first wave of COVID relatively well. Also worth noting, India is the world's largest manufacturer of the vaccine. So you've got a lot of vaccines coming out of your country. What happened this time around that you're in this crisis?
Yes, some of these things are unpredictable and hard to gauge on how a virus mutates, how its kinetic behaves. I'm not an expert in public health, epidemiology, or virology, but I think it has to do with how the virus behaves in the new geographic territory it is at. We were indeed lucky in the first wave, but it just seems so that core measures such as social distancing, masking, these things are tightly dependent on human behavior. And it is quite possible that after the first wave, during the second wave, things were a bit lax in that standpoint. And every country, developed and developing, have both dealt with this problem where the public use and public adoption of these healthcare practices makes a massive impact on how a country deals with a pandemic of this scale. So I feel that has a lot to do with this.
Well, it is incredibly devastating to see these images. For one, as I said, 2,000 people are dying every single day there. I know resources are on their way from the United States and other countries. We're thinking of you. We hope that that helps as well, and we'll make sure to stay on top of this story, because what happens there, in particular with some of these other variants, will certainly have an impact on the rest of the world. So Dr. Dilip Raman joining us from Bangalore tonight. We certainly appreciate your time. Thank you very much.
Thank you for having me. Thank you.